Good morning, everyone. I'm Axana Rodriguez Torres, UC Davis graduate student in the program of Masters in Public Health, and I'm also a director for pre-medical programming for the 12th annual Pre-Med Pre-Health Professions National Conference. It is my honor to introduce our next keynote speaker. As the current UC president, she leads our university system, which consists of 10 campuses, 5 medical centers, 3 affiliated national laboratories, and a statewide agriculture and natural resources program. She's a distinguished public servant with a record of leading large and complex organizations at the federal and state levels. She served as Attorney General of Arizona, Governor of Arizona, and also Secretary of Homeland Security. As Governor of Arizona, she focused on education, from pre-kindergarten through public higher education. She was the first woman to chair the National Governors Association and was named one of the nation's top 5 governors by Time magazine. Our UC president earned a Bachelor's of Science degree in Political Science from Santa Clara University, and then she received her law degree from the University of Virginia School of Law. In 2010, she was awarded the prestigious Thomas Jefferson Foundation Medal, which is the University of Virginia's highest external honor. I had the humbling experience of receiving from her hands the UC President Individual Outstanding Leadership Award in May during a Regents meeting, mainly because of the work for this conference with our Pre-Health Alliance student organization. Without further ado, it is my honor today to present to all of you University of California President Janet Napolitano.
Thank you. Thank you. Good morning, everybody. Good morning. First of all, let me thank you personally, Oksana, for your hard work in coordinating this conference, the largest of its kind in the United States. And I also want to thank everyone who is here for coming to this conference. Many of you took long bus rides to Davis. How many of you took a long bus ride? Raise your hand. Yeah. I'm with you. All of you have given up a beautiful Saturday to be inside, but it's important because you are learning about how to prepare for your future. Your presence is testament to your enthusiasm and to your dedication, both of which you will need in order to become a doctor, a nurse, or any other health science professional. So let's stop a moment and give yourselves a hand for your dedication. Let me begin this morning by telling you a story. It's a story about a man named Andres Anaya. Andres grew up 180 miles southeast of here in Fresno. His first language was American Sign Language. Both of his parents are deaf, so the first language he learned was the one they used. In kindergarten, Andres struggled with the spoken word and with reading. He just barely squeaked through school. He says that as a high school student, he almost never cracked a book, and he came close to flunking out. Ultimately, he did graduate from high school, and he then took a job at a tire and wheel factory in southeast Fresno. One day, Andres needed to repair a piece of machinery, and he crawled headfirst under the machine's metal door. While he was under the door, the machine somehow turned on. The metal door started to press down on his waist. Andres felt his bones breaking. Felt like he was suffocating. By the time someone managed to rescue him, 3 vertebrae in his lower back were crushed. It was months before Andres could walk again. During the months of recovery that followed, Andres made a decision. He made the decision to become a doctor. This was going to be challenging. He'd not been in a classroom since high school, and he had barely earned his high school diploma. But he was determined. And determination, as you will discover, often makes the difference between achieving your dreams and watching them slip away. Andres moved to San Jose for a fresh start. He enrolled in a community college. Soon he was earning straight A's, even though he was also working 40 to 50 hours a week to support himself. He transferred to San Jose State. He managed to graduate while still working full-time. After a year of hard study, he aced the medical school entrance exam, known as the MCAT. He was accepted at 7 medical schools around the country, and he chose his first choice, the University of California at San Francisco, UCSF, one of the nation's top-ranked, if not the top-ranked medical school. Earlier this month, Andres began his residency at the UCSF Fresno Medical Education Program. He's going back home. Today, he is an emergency room resident at Community Regional Medical Center in Fresno, where he himself was born 40 years ago. And when asked about his work, this is what he says: "Every day, I get to do something I love. I am literally living the dream." Now that Dr. Andres Anaya has achieved his dream, he has a new one. His new dream is to encourage high school students in the Central Valley to dream big and work hard. His hope is that some of those students will go to medical school, graduate, and return to the Valley to practice. I share Dr. Anaya's new dream, and I echo his hope that more medical school graduates will opt to practice in the Central Valley, whether or not they grew up there. But most of all, I'm encouraging you to follow your dreams. And I am here to tell you there's no better place to pursue those dreams and to undertake the hard work necessary to do so than at the University of California. Let me tell you why. The University of California has the largest health sciences education system in the country. Let me say that again. We have the largest health sciences system in the country. Nearly half of all the medical students and medical residents in California receive their training at the University of California. Now, some of those students enroll in something called Prime. You can write that down, or put it in your iPhone or whatever. Prime is a specialized track offered by UC for medical students who show an interest in working with underserved population. It stands for Programs in Medical Education. It combines specialized coursework with structured clinical experience and advanced independent study and mentoring, so that these medical students can work directly with local underserved populations. Prime currently has 330 students in 6 programs at UC. The Prime program here at UC Davis focuses on rural health and telemedicine. At UC Irvine, the emphasis is on Latino communities. UCLA targets a variety of local disadvantaged populations. At UC San Diego, Prime focuses on health equity, and at UC San Francisco, it focuses on underserved urban populations. There is also a Prime dedicated to addressing the shortage of doctors in the San Joaquin Valley. I encourage you to learn more about Prime and to learn about all of the opportunities the UC offers for graduate training in the health sciences. And I also urge you to look to the University of California for your undergraduate degree. A public research university like UC offers opportunities unlike those you could find anywhere else. And I believe, and I think the statistics and rankings show, the University of California is the best public research university in the world. In the world. I'll give you a stat. 61 of our faculty members have been awarded Nobel Prizes. We had a new Nobel Prize to one of our faculty just this week. Nearly 1,000 members of our faculty belong to something called the National Academies, which is the highest honor a faculty member can receive in his or her own field of expertise. And when you attend any one of the 9 UC undergraduate campuses, you will not only have the opportunity to learn from those who share knowledge, but from those who actually create knowledge through their own research. Many of you might be surprised to know that 44% of our undergraduates are first-generation college students, meaning none of their parents ever went to college. 1 of 3, a third of our undergraduates are from historically underrepresented minority groups. 25% grew up in homes where English was not the spoken language, or indeed, like Dr. Anaya, where the first language was sign language. Now, what about financial aid? Sometimes I hear people say it's too expensive. I can't afford to go to the University of California. Do your research. That's an inaccurate perception. 42% of our undergraduates qualify for federal Pell Grants, which are the big national need-based grants coming from low-income families. And we have something called the Blue and Gold Plan for California resident undergraduates who qualify for financial aid if your family earns less than $80,000 a year. Your family earns less than $80,000 a year, and you're from California, you will pay no tuition if you are admitted to the University of California. Let me tell you that again. If you come from a family that makes less than $80,000 a year and you are a California resident, you will pay 0 tuition to attend the best public research university in the world. We also have a program, it's called the Middle Class Scholarship, for students who come from families with an annual income of up to $150,000. And this lowers their college tuition tab significantly, even if they don't qualify for Blue and Gold or for Pell Grants. So the end result is that over half of our California resident undergraduates pay 0 tuition to attend the University of California. And about half of our student body graduates with absolutely no debt whatsoever. The point is this: do not remove yourself from the UC applicant pool just because you think you cannot afford it. If you qualify academically, you can't afford not to try to go to the University of California. So don't self-select out. Throughout this weekend, I encourage you to listen closely, meet new people, ask lots of questions. It is our hope that this conference will open your eyes to the limitless possibilities that await you in the healthcare professions. Possibilities you may not even know exist. This is a wonderful weekend, and it's a weekend for you. California is a land of opportunity. It is a land of big dreams. And when it comes to the need for health care in California, the needs are immense. We need you. By next year, it's estimated that California will be short 17,000 physicians. And this is a shortage that's particularly acute in rural areas of the state, where the number of doctors per patient is almost 40% less than in urban areas. And this situation is not getting any better. 32% of the doctors practicing in California today are age 60 or over. Our state home is home to the second oldest physician population in the world. We need you. We need you to go to school and become educated as physicians and nurses and healthcare professionals. We are counting on you. Now, I know the path to becoming a doctor or a nurse is not an easy one. It is, however, a worthy journey. You're here. You took those long bus rides. You rode overnight. You've given a weekend because you are already the kind of dedicated, smart, motivated, and compassionate students that the University of California wants. And our commitment to you is just as firm. We are here to help you fill your dreams. So dream big, because there are many, many opportunities before you. Thank you, good luck, and fiat lux.